The process of placing a mini dental implant is basically we do a consultation to make sure that you're a candidate. And for the most part, we review things like medical history, diabetic, any things that would be contraindicated to the success of any implant, let alone a mini. There is a disadvantage, and that is they require dense jawbone in order to work. So when we place them, we can't have any movement while the implant is healing and integrating into your jaw. That would result in a failures. These are the type of things that we eliminate and treatment plan for after your consultation. You'll be coming in, we'll do a dental CAT scan of your jaws. It gives us an idea of the density, location of nerves, what size, how long, the length of the implant, and customize that just for you. After that, we can formulate a treatment plan and ready to go. The actual work placing the implant in your mouth is a very brief procedure, usually 5 minutes from the time we start to the time it's in place. So the beforehand, the workup, we call it the workup, is the most time-consuming and the most critical in my opinion. Since a mini implant is indeed less invasive, and I like to refer to the mini part as minimally invasive, the healing is uneventful. In 99% of the cases that I do, they take an aspirin maybe the night of. Okay, so they really are pretty mild from that standpoint. It's a small little pilot hole that we use to get it started, get the implant started. It's placed, and we do a final x-ray and you're out the door. If you think you might be interested in learning more about this and what they might be able to do for you, these mini implants, once again, call our office, schedule a free consultation, and we'd be happy to help you.